Welcome to the Pain and Brain Healing Center's Functional Medicine website. Hello, I'm Dr. Greg Forrest, author of the bestseller, Why We Hurt, and clinic director here at the Pain and Brain Healing Center. Possibly you found your way here online because you're frustrated and confused. Frustrated and confused because you or loved one is suffering with chronic fatigue and wondering if it's your thyroid. What we're going to talk about today, chronic fatigue and hypothyroidism. Now, many individuals are very frustrated because they go and get lab tests and they're just told that the lab tests are normal, but they go, but doc, I'm still very sick and very tired. I'm fatigued. Now, one thing you have to understand is that they're only running the very minimal of tests, very, very inexpensive minimal tests that are non-specific tests. They're not getting to the underlying biomarkers of your optimal health. Again, these are normal levels, not optimal levels for you. And the lab test results may be inaccurate for you because they are a statistical average. This is how we run it. We run a group of individuals, run the test, and then take the average, and that aggregate is called normal. Now, is this a healthy society or a sicker society? So we're grabbing maybe not the most optimal health. Maybe optimal health is more out here or here, depending on the test you're running. So this is something that functional medicine understands and looks at. We look at many different biomarkers, and we look at optimal levels, not, quote, statistically normal levels. And this is important, especially with thyroid, because TSH is the main thing that is looked at. And if you really want to get better, if you want to heal, you have to think outside the box. Now, what is that box? That box is the thinking of the doctor that you are seeing. If you're seeing a practitioner who says, you know, all you need to do is a TSH. That's all we're going to do. And that TSH, if that's going high, your thyroid is going low, we need to give you Synthroid or levothyroxine. And if it's not, then you're fine. That is leaving out a lot, and that's your doctor's educational prejudice. Or it's like I tell patients who have developing like rheumatoid arthritis, and they go to a rheumatologist, and the rheumatologist says, we identified you have rheumatoid factor, you have rheumatoid arthritis, so take this Remicade. Now that's a drug that will suppress your immune system and your inflammation goes down, but that leads to a lot of problems down the line. You can imagine suppressing your immune system for years. It does lead to chronic infection, cancer, and other issues with these really strong drugs that may not be the very best way to go after your autoimmune disorder, but this is your doctor's medically necessary or standards of care approach. Then you have insurance companies that are setting up this box for you, and they create what's called the standards of care and what's medically necessary. Medically necessary is a real catch term here. I don't do what's medically necessary. I do what's necessary for you. I do what's optimally necessary for your optimal health. And this is a term that our insurance industry has created, and it's a real trap for you. Now we're going to look at what is going on when I just can't seem to get out of bed, I'm tired, I'm fatigued. Is it my thyroid? Well, it could be many different things, but let's look at thyroid to begin with. This energy and vitality comes down to the cellular level. This energy is something called ATP. The term is not important, but your powerhouse in your cell, called the mitochondria, produces this. And if it produces, you actually produce your weight in ATP every day. If you produce this robustly, you have all the energy you need and want to do all the things that you want to do in your life. Now, how does this happen? This thyroid, it's called T4, is converted to T3, and T3 enters the cell and then kicks that mitochondrial gear, and the mitochondria starts generating more ATP, and now you can grow your hair, have good healthy skin, not be constipated, all those things that you hear about with hypothyroidism. Every cell in your body has a thyroid receptor. So this is the key to kicking this in gear. But wait, you need to have a substrate. You need to have something that you can build energy out of. So let's look at, you need calories, blood glucose. You need to get that into the cell. How does that get into the cell? Maybe you've heard of insulin. People who are insulin-dependent diabetics. We're seeing a phenomenon now today with insulin resistance. It's huge. 40% of adults today in America have insulin resistance and don't know it. 1 in 3 children born from the year 2000 on will be diabetic by the time of middle age. This is huge. We're seeing more and more insulin resistance, and there's multiple reasons. And there's another video that you can look at to understand this. But if you have insulin resistance and you don't get the calories in to be burned for energy, you know what you do with them? Your body stores them as triglycerides and fat. So if you're wondering, why am I getting bigger and bigger? I have all this energy and I can't get up out of bed. You may have insulin resistance, or you may not be kicking that mitochondria in gear. So don't just focus on one thing. And everyone thinks it's my thyroid. It could be. So muscle cell, nerve cell, skin cell, all these have to do this, produce the energy to do the things they need to do. Now, let's take a look at this a little more in depth. And if you have, if this is a little bit confusing, I suggest you replay the video again. I know this gets a little bit in depth, but I don't give easy answers at this clinic. Too many people are running around just getting easy answers. Drink this green juice, this blue juice, get adjusted here, get this drug here. And we all want it to be simple. I'm here to say it's not simple. And as long as you keep looking for simple answers, you're not going to heal. To get the right test done and get the right answers, you can get health going. This is representing an area of your brain called the pituitary. It releases this thing that we measure called TSH, simply meaning thyroid stimulating hormone. It kicks the thyroid in gear. The thyroid puts out T4. If this TSH level is going up and your doctor measures that, he's going to give you Synthroid or levothyroxine. Now here's where you start seeing some problems. This is all they'll test, maybe T4. Then there's this whole range. Lab ranges go from 0.3 to, say, 5. Now, I think it's the American Academy of Clinical Endocrinology says that 2.5 should be the threshold. So we might not be, and that threshold for high TSH has been coming down. This again gets into the what's optimal, what's normal. So that aside, we also then have to look at what is our body doing with T4. This is not the actual hormone. This is a prohormone. It's a storage hormone that our liver, kidney, GI cells convert into T3. Again, just back it up and play it again if this seems a little confusing. But TSH stimulates the thyroid. Thyroid kicks out T4. But then your body cells have to convert it into T3, take a portion of those and make it free T3, and that enters the cell, kicks the mitochondria in gear. The mitochondria then kicks out ATP. Voila, you grow good thick hair, you got good thick skin, healthy skin, you're digesting your food, all the things are running fine. But what if you are not converting this? This is called peripheral hypothyroidism, and you don't know that unless you test for T3. And very few patients come in have been tested for T3. This is the gas pedal to everything. So if you don't have enough, pedal in the metal, you're not pushing down and getting this mitochondria going, you can have good T4 levels of say 1.2, really robust levels, and down here we got something like 2.3, not enough. Then if you have a gas pedal, you better darn well have a brake, and that's called reverse T3. And your body will make this to block the T3 so you can kind of slow down metabolism. I don't know if you remember the character Don Knotts. He'd be someone who didn't have enough reverse T3. Okay, so now sometimes under certain conditions you're converting this T4 to too much reverse T3, you're creating too much block. So now you got the brakes on. Not enough gas and too much brakes on. So this is not stimulated to produce the ATP and energy. And then again, please don't forget, you need to have calories in to produce energy. Insulin has to bind. You could have insulin resistance that's caused by inflammation. Chemicals in our environment are now been shown to block insulin. Many different issues, but the main thing you need to understand today is that you need to have proper tests run. Hemoglobin A1C, triglyceride, HDL ratio, different things that will tell me early on, 10 years out, if you're headed towards diabetes. Huge. Now also, mitochondrial function is huge. You can poison mitochondrial function by chemicals, heavy metals, inflammation, and not the proper micronutrients. Because these mitochondria love they need B vitamins, magnesium, and you could have insufficiency of these micronutrients because of malabsorption, maldigestion. So all this needs to be looked at. One other thing, 70% of all women today who have hypothyroidism have Hashimoto's. They're producing antibodies and they're killing off their thyroid. This is important to understand. There's nothing wrong with your thyroid. It's like it's in a bad neighborhood and it's getting drive-by shooting, and the immune system is taking it out. If you're an individual, your doctor has to keep raising your thyroxine or levothyroxine and doesn't know why, thyroid antibodies need to be looked at. Then they're still going to just keep giving you T4. Medically, they watch your thyroid die while they keep upping your medication. Does that make sense? Why not find the underlying cause of the autoimmune? What is stimulating the immune system to be so upset? And this gets into this dysbiosis, bad bugs in the gut sometimes, or certain bacteria, candida, food allergies. Gluten has been shown to be a high proponent of a Hashimoto's autoimmune disorder. So what I'm trying to say is thyroid is very important, but there are many different aspects to it, that need to be looked at and properly diagnosed. And if you're not doing that, you're not going to get better. So you need to see a doctor of functional medicine who looks at these issues and diagnoses them. If this seemed a little complicated, rewind, play again, you'll get it. So if you really want to heal, you have to think outside the box. That box set up of the prejudice of your doctors and insurance companies, and run the proper tests. Run the right tests for you, and then once you identify an underlying cause, you need a doctor who understands how to treat them. Using what I call the 3R program, we're going to identify and remove what's causing harm. Again, dysbiosis, heavy metals, food allergies, whatever there is, restore what is missing, deficiencies. To convert T4 to T3, you need selenium, zinc. There's different nutrients that are needed. There are herbs that can help modulate this and move this T4 to T3 conversion. You need to restore nutrient levels throughout the body that are missing or deficient. Then we need to activate repair, and that we do through different therapies here. We do myofascial therapy if there's pain or structural care. Acupuncture. Acupuncture is tremendous for stimulating and activating repair of tissues. We use brain-based therapies to help you get into a better healing state. The body heals when it can get into what's called theta brain waves. Most of us are up, active in beta, sympathetic, we're charged, we're stressed. We don't know how to get into that theta state, that parasympathetic theta state. And we have new technology that'll help you go there. And there's articles online here that'll explain how we do this here at the clinic. So, how are we different? Chronic fatigue, hypothyroidism. We leave no stone unturned. We get to the underlying causes. We use comprehensive health history and diet. We look at I do a comprehensive neurological nutritional exam. We do functional lab tests specific for you, comprehensive blood profile with multiple biomarkers of optimal health. Thyroid, we do 9 different tests to get to the underlying cause. We do functional adrenal testing, comprehensive assessment for insulin resistance, mitochondrial functional assessment. We can do that through a urinary organic acid profile. Comprehensive digestive stool analysis, look at maldigestion, malabsorption, dysbiosis, IgG ELISA food allergy testing. We will leave no stone unturned to get the underlying cause and fix it for you. You can get better. You can overcome this. But if you found out that you had a brain tumor, but you had knee surgery done once before, and that guy did a great job, but the insurance company is not covering the brain surgeon that you want to go to. Would you go to the knee surgeon to get the brain surgery just because it was covered by insurance? No, you'd go to the very best clinician for your condition. And that's what you need to do when it comes to functional medicine, who can take a functional approach to these underlying disorders and create a healing pathway to you. So, again, we are different. We will get to the underlying cause. I want you to know that there is a path out from this chronic fatigue, this aches and pains, this not having the life you want. All you need to do is give us a call here at the clinic, and we can set up a free consultation. You can bring in the clinic biomedical adult history form. You go online, do new patients, and then the new patient intake form, hit biomedical adult history, fill it out. I need to have some data to go over with you. And bring in any lab tests that have been run, and I can look at those. Bring that in, we'll sit down 15 minutes and we'll discuss this, and I'll let you know if I can help you. And if I can, I'll help you understand what it is that we need to do. So thank you for listening to this video, and again, any questions, repeat it, run it again, give us a call. We'll be more than happy to help you. I hope to see you soon at the Brain Healing Center. Thank you.